At the age of 53, Catherine Kariuki received unexpected news from her doctor.
Without preparing me mentally or anything, she just looked at me straight and told me, "Kathy, I think cancer is here with us."
And after several medical tests, her fate seemed to have been sealed.
I remember so well her words, "Catherine, if I were you, I would think about going to India immediately." She told me, "I have a hospital, which is a very good hospital. I was there, I took my cousin to that hospital, and they are very good and all that. I'll give you all the info about them." And I said, "Yeah, okay, now here we start the journey."
It is then that Catherine embarked on a cancer treatment journey in India, having raised the 1.2 million shillings needed for her treatment. However, the puzzle of one key test remained.
So far until that time, no biopsy had been done. I was put through chemotherapy. Then I came back to Kenya. I went through all the chemos. When I went back, the tumor was still there.
Catherine continued to battle with what was said to be cancer until a friend advised her to change doctors. It is at this moment that hard questions were asked following the realization that the hospital was unable to provide documentation on her cancer treatments that saw her undergo 2 major surgeries.
I don't know. I really don't know whether I had cancer or not. I really don't know whether I have cancer or I don't have. But right now, as it is, the good news is that my blood tests are showing negative.
Catherine is, however, not the only one. Numerous patients have been taken advantage of at their moment of weakness while seeking medical care. Rogue doctors have over the years been thriving on referrals for chronic diseases to various countries. They allegedly get kickbacks from foreign doctors, a trend that the Ministry of Health has begun to tame.
Information was being withheld to patients, and it's still happening, where patients are not told that, look, this country is quite capable of doing kidney transplants. This country can treat cancer adequately, or this country can treat heart diseases.
Cancer is a very, very big business. A big business, multi-million business. And people will kill for it.
In a memo to doctors, the Director of Medical Services, Jackson Koiko, has directed that doctors will only refer in their areas of specialty for services not locally available. Doctors will also have to write to the Director, giving adequate information on the patient's condition, while patients under the National Health Insurance Fund must duly fill requisite forms.
It's a very commendable thing, but these guidelines must be enforced very, very strictly and monitored to ensure that there are no patients that are slipping between our fingers.
The government is focusing on the growth of universal healthcare, with specialists hoping that more Kenyans will be treated locally. Mombi Warowe, Citizen Weekend.